changing the way we look inside the human body with diagnostic accuracy that changes the way physicians treat their patients. Visualizing never-before-seen sections of the small intestine. M2A capsule endoscopy from Given Imaging, expanding the scope of GI.
Now we move into a completely non-invasive technology, which has allowed us to investigate patients in a truly painless way.
Capsule endoscopy has become an important part of our clinical routine, modifying our knowledge about the small bowel.
I don't think it's an overstatement to say that having these kind of capabilities help to make us all better doctors.
The Given diagnostic procedure. It's as simple as swallowing a multivitamin-sized disposable capsule. The M2A capsule with its miniature camera moves naturally through the GI tract by peristalsis, transmitting images to a wearable sensor array, connected to a portable recording unit that downloads clear, sharp images to a dedicated workstation, where Given's proprietary rapid diagnostic software streamlines the data into an easily viewable video.
It's a very exciting modality because it reaches areas in the small intestine to which we've really been limited before.
We see a lot of findings that were completely unexpected.
Especially diseases that manifest in the distal small bowel.
I think capsule has, in my mind, replaced enteroscopy in the first line in the evaluation of obscure gastrointestinal bleeding.
Clinical studies in over 60 sites around the world demonstrated the diagnostic effectiveness of M2A capsule endoscopy. Thousands of patients have benefited from this innovative technology, detecting conditions that often elude traditional procedures. This 80-year-old male suffered from intestinal bleeding with repeated transfusions. No diagnosis had been made.
So we decided to perform capsule endoscopy, and here we saw normal mucosa in the duodenum, and if we go further down to the jejunum, we can see that the villi are atrophic. Throughout the jejunum, the mucosa is flattened, and here, astonishingly, we could find celiac disease with active bleeding in the jejunum. Biopsies excluded lymphoma in the small bowel, and with capsule endoscopy we could set up the diagnosis of celiac disease and find the bleeding source in the small bowel, which was not possible before with gastroscopy and colonoscopy.
This 13-year-old girl had chronic obscure GI bleeding, took steroids for asthma, had undergone surgery in infancy, and required repeated transfusions. Numerous procedures yielded no diagnosis.
The capsule revealed a prominent area of ulceration in her descending duodenum. It was theorized that perhaps the reason this was missed on regular endoscopy is because of the air insufflation that we perform with endoscopy and the possibility that that may have masked the lesion, so to speak. She did very well with the capsule. She had no difficulty swallowing it. And the findings were confirmed by an enteroscopy. The lesions were biopsied and the pathology was consistent with Crohn's disease.
This 44-year-old male suffered from fatigue and arthralgias with iron deficiency anemia. All diagnostic studies were negative.
The patients underwent capsule enteroscopy, which showed up to a certain point the mucosa was perfectly normal, while at 1 hour 52 minutes this lesion appeared, a small protruding mass within the lumen of the gut with a red streak on top of it. Beyond that point, the lumen was filled with blackish material, which was interpreted as hematine. The patient was then operated on, and tumor lesions of 4 centimeters in diameter was found, or 250 centimeters beyond the ligament of Treitz. The path report of this lesion came back as a malignant gastrointestinal stromal tumor of the small bowel.
M2A capsule endoscopy. It's changing the way physicians treat their patients.
We are beginning to see data coming in to show that it really impact on the way that we manage our patients.
Capsule endoscopy can help to reduce the number of procedures.
We are going to take better care of the patients.
This has really changed what my practice was like before.
With current applications for a variety of gastrointestinal disorders and future applications for suspected blood indication and accurate localization within and beyond the small bowel. M2A capsule endoscopy from Given Imaging, expanding the scope of GI.